I'm here to further on what Maureen has said. And when I think Maggie and I started quite a number of years ago, we were part of that group of saying where the drugs, most of the drugs were going into more common diseases. But now that those have sort of settled or gone through, it's great to see interest from the research pharmaceuticals as well as government to helping fund many of these rare diseases. So part of this is to have an organization to try and even locally here. So we formed, I don't know how long ago we formed it, 5 or 6 years ago. 2010? Boy, I'm getting old. Less and less hair as I go along. So we formed the Hamilton Scleroderma Group. So I think Lacey was referred to the HSG, and that's who we are. And many of the speakers tonight are part of the HSG. So the HSG is really geared towards looking at 3 things: clinical care, research, and education. So tonight is one of the fulfillments of the educational part of that too. So our goals are to try and lead the way in patient care. And all of the Hamilton Scleroderma group doctors are attending physicians here in the academic institutions of St. Joe's Hospital and McMaster University. So if you go to the SSO website, you can get, I think you can still get to HSG, and then we developed this schema a while back, and I still think the other physicians would agree that rheumatologists like Maggie and myself are the quarterbacks for scleroderma. So that's why we're in the center. Not to diminish anybody else, but for instance, today, Dr. Burchick is from gastroenterology. He'll be speaking. Dr. Margetts will be speaking from nephrology. And last year, we had two respirologists, Nathan Hambley and Dr. Jerry Cox, come and speak. And then cardiology, immunology, and of course, the advocacy groups like the SSO and SSC are extremely important in this schema. So that's, okay, yes? You want to speak louder? Okay. So that's our local group, and we began here actually in Hamilton with a larger Canadian group, the CSRG, which preceded us. So I started again 15 years ago with the CSRG, so it's been going on for a while. And the CSRG is intimately communicates back and forth with the patient advocacy groups, the Scleroderma Society of Ontario and the SSC and all the local chapters as well. So many of you might already be participating in this database. So there, it started in August of 2004. It's what started off as an annual assessment, but now for patients that have been in this for a longer period of time or have had disease for a long period of time, we are now doing, I think, every 3 years for those patients as well. So there'll be labs that are sent. Some of them are sent off to Calgary, where we have a bank there with Marvin Fritzler, who has a great interest in scleroderma. So what Maureen was talking about was how much needs to be sort of poured into this disease to try and get the goal or the gold. So even though we've had 128 publications, we're still have just scratched this, and that's only the CSRG. We've just scratched the surface. So I just put up a few things that we have published in the last couple of years. So clinical, meaning how patients are feeling, their fatigue, pain, physical exam, and then the biochemical. So the biochemical are looking inside the body looking at antibodies, looking at the biochemistry that will help us develop the drugs, because now instead of using a drug for the whole body, it's called personalized medicine, where we try to figure out whether your biology is different from somebody else, because one drug does not fit all. So Maureen has probably an update. She told me that she has an update on SPIN. So so the SPIN is not we're spinning around, but the Scleroderma Patient Centered Intervention Network. So this is a group around the world. So experts from Canada, the US, Netherlands, and France are looking at developing and testing online programs for exactly that clinical issue of fatigue, pain, your hand function, coping with stress, body image, for instance, too. But Maureen's going to give us an update on that.
Thank you. Yeah, it's taken a long time for those who have been participating, and continually filling out your forms online is really a big deal. I know it gets tiresome, but it really is important. So each of these are separate trials within a trial. So as we hit the end of a trial, we're able to release these programs to the general public. We'll be releasing them through our website, Scleroderma Canada and Ontario. I know the hand function one is almost ready to be released to the general public. We're looking at getting that sometime later this spring. But there's an additional 3 programs that are developing. So there's one for support group leader development, an online program for anybody who's interested in running a support group, to give you some skills to actually help you do that. A second one is based on physical activity in scleroderma and measuring the degree to which that is helpful or not. And the third one has to do with caregivers. And depending on where you are in the world, they talk about caregivers or carers. They all have, but basically family members who support you or friends who support you. Programs specific for them, both in terms of helping them understand the illness and giving them the skills to help you manage your illness better.
Excellent. So that's the clinical part that you can participate in. So the basic science, we have many local researchers. So Dr. Mark Larché, along with Dr. Maggie Larché, are looking into how immune cells trigger fibrosis in scleroderma. So if you can get at the root of the cause at the initiation and even try and prevent it from occurring, that is right at the beginning of the disease. Dr. Kolb is one of the researchers that are looking at fibrosis in the lungs and the link with the skin. And Dr. Kjetil Ask, who was here last year, I don't think he's here tonight, but he's working on the immune cells and how they interact with fibroblasts. Peter Margetts is going to speak a little bit more about his research in the kidneys and scleroderma and its association with scleroderma. And again, Dr. Burchick here tonight will talk about the gut and its effect in scleroderma. So how can you help? I think Maureen was talking a bit about this. So I pulled these slides. We use these, the R on there is for rheumatology. So we're trying to recruit people into rheumatology. But here we're going to try and recruit you and convince you to be part of the solution. So really, how can you help? Well, for the patients, when we approach you for blood samples, skin biopsies, stool samples, so we'll send them all over to Dr. Burchick. And we're doing a lot of that here in Hamilton. So what about relatives and friends? Well, they can often help by acting as controls in some of the studies, so that we may ask to get skin biopsies from you to compare, because often it's if you don't know what's normal, you may not know what's abnormal, or even its effect with a certain specific drug. And then getting involved in fundraising initiatives. So as you heard, research in rare diseases, even trying to recruit patients. So, in cardiology, There's 60,000, 100,000. There's just no way we're going to get those numbers. And actually, every single patient number, when you're dealing with up to 300, it's hard to recruit for these studies. So we'll be trying. So just be receptive because you'll be helping out. So some of the very specific studies that we've participated in is one of which is this new drug called Riociguat, which has been used for high blood pressure in the lungs, and it's now released in Canada for that purpose. But Bayer had decided to study it in scleroderma. So we've had a couple of patients in it, but unfortunately, the phase 2 trial, which is what this was, we think that they chose the wrong primary endpoint, meaning the wrong goal, the main goal, and so that all the other goals get wiped out, unfortunately, when that occurs. So they're thinking about doing the phase 3 trial. They're thinking hard about doing that next step, and if they do that, they have to choose a different goal. And then this is a Boehringer Ingelheim drug for the lung fibrosis called nintedanib. It's released in Canada for IPF, which is idiopathic pulmonary fibrosis, but there's great interest in using it in other sclerotic conditions. So scleroderma is one of them. So that's the purpose. The trial is finished enrolling, but results are going to probably take another year or two, and you can see how long it takes. And then the big buzz is all about stem cell transplant. And Dr. Larché has worked very hard at looking at trying to get stem cell transplant here locally. And now there's a Canadian consortium that's beginning to develop to look at stem cell transplant. So that's really the process there, which is taking your cells out, and these are just your baby cells. We all have baby cells in the bone marrow that can become anything. So taking out your baby cells, keeping them somewhere, and then ablating your old immune system, the old memory, and then putting in these stem cells to reset your body that would hopefully not have the scleroderma in it. And so there's been 2 major trials. The first trial is this trial that was published in one of our, as Maureen was saying, these medical magazines. This is a very famous one, JAMA, the Journal of American Medical Association. So you can go and Google this and you can see them. But again, to try and put it into lay terms is always a little tough. So this was the European trial, and it seemed to work. The unfortunate thing is it's not for every single scleroderma patient. It's for diffuse scleroderma patients, and you can't be too early and you can't be too late. So it's for a very highly specific group of patients, and so it's always good to have a confirmatory trial. So this SCOT trial, not the Scottish trial with all this weather that Maggie's talking about, but was a U.S. one. So it confirmed these results were released in abstract form last year, and then you can see it was published in our sort of the big #1 journal called the New England Journal of Medicine. So you know it's big time when it gets to there. So both of these seem to work. So the problem is that, if you decide to do stem cell transplant, that there is more upfront problems than long-term problems. So so mortality, dying from this upfront is higher than using cyclophosphamide right off the bat. But down the line, more people survive and do better with stem cell. So locally, we don't do stem cell yet, and there's some discussion, but we now have a link in Ottawa, and I've already sent 3 or 4 people there, and I've had one person have the stem cell transplant. So it is available to Ontarians as well. And then the lung, there's a Canadian registry. It's called the CarePF. And this is part of the funding here is from a pharmaceutical company as well. So they're not running it, but at least they're helping collect information for our Canadian statistics. And then this is a slide that I did over the weekend, which was 70 studies. But as you can see, Maureen says they're up to 76 now. So that's truly amazing for it to see. So you can make a difference by participating in all the things that you can. So a cure for scleroderma will not happen without collaborative research efforts. So we can't just do it here locally in Hamilton. It's got to be tied with patient groups, with finding the patients, with our local colleagues, with our national colleagues, and our international colleagues. And Maureen is chock-a-block international, trying to bring the Canadian experience to the international scene, as well as bringing that back to Canada. So, so many studies are in the works, and we have great hope to reach the goal of a cure for scleroderma that Lacey was talking about. So we hope you'll participate and you can help to make a difference. Thank you.